I've been a community health worker for 2.5 years, and what inspired me to be a community health worker was to be more engaged in the community and help people who were in need of resources.
I've been a community health worker for 1 year. Going through college and all those classes, I was introduced to social determinants of health as a concept, but COVID-19 really put that into practice, and we saw how underrepresented communities can be disproportionately affected. So that kind of ignited my interest in community health and what led me to this career. So community health workers, they serve as the bridge between the community, patients, and the healthcare system. So we act as a resource for those patients to connect them to services that might be able to close those barriers to care.
I'm someone who is willing to listen, because a lot of patients, they feel that doctors or some doctors, some nurses not really listening to the needs that they need. So as a community health worker, we're more engaged in the community and people who are willing to listen, and so we can report it back to the team to talk about their needs.
One of the main successes that was achieved through this project was the ability of our CHWs to really identify and address social determinants of health, and really understand what our patients are going through, and being able to connect them to resources within the community.
Community health workers not only connect patients to community organizations, but also to other services within the healthcare system. So recently I've been following this patient for the last few months, and I was notified that he was going to be dismissed as a patient at another clinic because of a barrier to attending his appointments. I was able to advocate for him and make sure that clinic was aware of what was going on with him and ensure that he was able to attend his next appointment.
One example that I could provide when helping out a patient was that she needed housing resources. I was able to connect her to legal aid, and then we had to go through, the court system. She was granted 30 extra days to stay in the current home that she was in, and then once she got approved for the funding, she was able to find more permanent housing for her and her family.
The experience with data reporting and our CHWs at VCU Health was fairly easy. Now, granted, at VCU Health, we've had CHWs within our clinical environment for decades. So, the way we view tracking and monitoring data is very different, and it may be more challenging for smaller organizations or newer organizations who are just now starting to implement CHWs within their environment. We've been doing this for a while now, and we have a big commitment to the work that our CHWs do. So data reporting was fairly smooth because they do this on a consistent basis.
As we've seen, our healthcare system isn't perfect. There are gaps within this system, and unfortunately, patients often fall through. Community health workers often come from that community and are able to see those gaps and assist with filling them. And while patients go through a lot of complex problems and there aren't always an easy solution, being able to advocate for those patients and help them advocate for themselves is fulfilling.
For an example, I've came across a lot of patients that they express their concerns about transportation needs or housing resources or medication costs, and they express those concerns to their doctors or the other team members on their care team, but they haven't been able to really give them those resources. So me as a community health worker, I come onto the scene and I'll be able to navigate them through the healthcare system to find those resources and to address those concerns that they have. So yeah, they're very thankful. They cry sometimes, and I even cry sometimes, because I'm able to really take that weight off of them. So it's a good feeling to be able to have somebody that shows that they care and is willing to help them.
I believe that there are two main lessons that really are beneficial for organizations in establishing and sustaining a CHW program. Tracking and monitoring data is very, very important. This allows you to be able to tell your story of what your CHWs are doing. It allows you to tell your story of the impact they're making within your clinical environment and within the community. And then also along with that is organizational buy-in. Just having an understanding of what the CHW does, what their role is, how are you going to integrate them within the clinical workflow. And I think with those two lessons, you can be successful and set your CHWs up for success within the clinical environment.